Thank you, and hello from Chicago. Neither I nor my co-authors have any financial disclosures. The American Board of Pathology has been involved in ongoing efforts to collect data to allow for better harmonization of GME training with training requirements, board certification, and the practice of pathology and its subspecialties. Information regarding residency training and hematopathology has already been published. The focus of this effort was to gather and analyze information regarding cytopathology, specifically with respect to fellowship training, the practice patterns and needs of cytopathology diplomates, and perceptions of the ABPath cytopathology subspecialty examination. To this end, we deployed two surveys. The first was an optional cytopathology section in the 2019 Practice and Training Survey. Participants included diplomates doing continuing certification reporting to the board who had practiced within the last 2 years and completed a cytopathology fellowship. The second survey was sent to all 93 cytopathology program directors in 2020. I'd like to spotlight for you some of our results to give you a sense of the type of information we were able to gather. Diplomates are largely in group settings and had been in practice between 3 and 13 years. A significant majority had a second fellowship, most commonly in surgical pathology or one of its specialties. In contrast, training programs are nearly all in academic settings and are almost equally divided between having 1 and 2 fellowship positions. Program directors had been in their current role for an average of 7 years. For the vast majority of diplomates, as well as the faculty who train them, surgical pathology is an essential component of daily practice, and for diplomates, the larger proportion for many. Cytotechnologists are employed in all training programs and involved in screening the vast majority of case types. This is not the case in diplomates' practices, where CTs are involved and employed in 82%, and a significant amount of primary screening is done by pathologists for FNA and non-gyn specimens. Shown here are diplomates' specific duties related to the daily practice of cytopathology. These are reflective of an individual's workplace and role, underscoring that practice needs may evolve over time with the number of years in practice, and therefore not always align well with a 1-year fellowship. Laboratory case volumes are certainly important to the overall fellowship training experience. When we looked at these across programs, there were major differences, with lower numbers reported in cervical cytology, anal cytology, and FNA of certain organ sites, as well as core biopsy and touch preparations. The number of annual cases that an individual fellow signs out with faculty is also highly variable. The ACGME suggests that fellows review approximately 2,000 cases over the year, with at least 500 each of GYN, FNA, and non-GYN. This requirement, as you can see here, may be challenging for some programs. For performance of FNA and core biopsy procedures, 30% of programs report that their fellows have no exposure to image-guided FNA experience. On the other hand, rapid on-site evaluation in radiology, bronchoscopy, and GI is much more universally available. However, rows for core biopsy touch preparation is minimal to no exposure for fellows in about 44% of programs. In programs where there is exposure to core biopsy, handling differs. Only in 40% is the core biopsy and FNA and touch preparation signed out by the same pathologist. With respect to supervision, the ACGME has renewed its emphasis on the need for graduated responsibility and has delineated well-defined supervision levels. Cytopathology fellows attain a level of independent responsibility with only oversight supervision, largely for the performance of rapid on-site evaluations and superficial FNAs. It's nice to see that about 75% of programs do report the use of at least some telepathology. A smaller subset of PDs responded to the question regarding oversight supervision for independent case sign-out, and among them, a proportion report that this practice does occur in their programs. Here is the Diplomates' overall perception of their fellowship training compared to what they need to be successful in their current roles. Highlighted are areas in which training was considered to be less than ideal to none. I specifically want to highlight this particular box in which there are areas that have also been repeatedly identified over several years in the annual practice and training surveys as being less than optimally covered during residency training. Some areas were also identified where perhaps more than necessary training is provided. Diplomates' perception of the cytopathology exam content compared to what they need to be successful in their current position was considered to be about right in most areas. Those with lesser concordance are ones in which there is typically less training in the fellowship period. With respect to the type of questions on the certification exam, diplomates view the practical and glass slide ones to be most reflective of their knowledge, judgment, and skills. PDs were presented with the 2019 cytopathology examination grid and asked if and how they would recommend changing content emphasis. Areas are highlighted here, and those are the ones in which PDs suggested that we consider decreasing emphasis. Now, these areas do correspond to ones in which labs have reported lower volumes. PDs also suggest that the lab management content of the examination be decreased. Of note is the fact that 35% of program directors were not aware that the American Board of Pathology's website displays descriptions and content grids for all of its examination. In conclusion, our data shows that there is significant variation in fellow experiences across cytopathology training programs. The diversity of case types as well as volumes may be less than optimal in some. Independence with oversight supervision is largely limited and available in most programs only for superficial FNA and rapid on-site evaluations. Opportunities to better align training and training requirements with the practice needs of cytopathology diplomates were identified, and these were both with respect to specific areas of exposure as well as methods of training. There is a need for increased graduated responsibility for our fellows to be better prepared to enter independent practice safely and effectively. There were differences in diplomates and program directors' perceptions regarding the cytopathology certification examination, information about specific content, the type of questions, and the need to have PDs better informed about the American Board of Pathology's examinations have been noted. As next steps, we plan to continue to share and publish this, as well as other data that is being generated from the American Board of Pathology's collaborative efforts toward providing an evidence base to inform changes to training and certification. Many thanks to everyone listed here for their contributions to this particular endeavor. And I'd like to also thank all of you for your attention.